Ever wondered what exactly diabetes is and how it affects your body? Well, let's break it down. Diabetes is a condition that occurs when your blood sugar, also known as glucose, is too high. This can happen when your body doesn't produce enough insulin or isn't using it effectively. Insulin is like a key that helps glucose get from your bloodstream into your body's cells where it's used for energy. But when there's a problem with insulin, glucose can build up in the blood, leading to high blood sugar levels. Now, glucose is primarily sourced from the carbohydrates in your food and drinks, and it's your body's main source of energy. So imagine your bloodstream is like a highway. Glucose is the cars on the road, and insulin is the on-ramp that allows the cars to reach their final destination, your body's cells. When there's not enough insulin or the insulin isn't working correctly, the glucose or cars remain stuck on the highway. This results in a traffic jam, or in medical terms, hyperglycemia. Over time, consistently high blood glucose levels can lead to an array of health issues, including heart disease, nerve damage, and eye problems. This is why managing diabetes is so crucial. But not all diabetes is the same. There are several types, including type 1, type 2, and gestational diabetes. Type 2 is the most common, where your body either doesn't make enough insulin or doesn't use it properly. Then there's type 1, an autoimmune disease where your immune system attacks insulin-producing cells in the pancreas. Gestational diabetes, on the other hand, arises during pregnancy and typically resolves after childbirth, though it does increase the risk of developing type 2 diabetes later in life. There are other types too, such as type 3C, which is caused by damage to the pancreas, and latent autoimmune diabetes in adults, or LADA, which develops more slowly than type 1. Understanding what diabetes is sets the stage for exploring its symptoms, causes, and how it's diagnosed. What signs might suggest you have diabetes, and what triggers this condition? Well, the symptoms of diabetes can often be subtle and easy to overlook. They may include frequent urination, unexplained weight loss, constant thirst, constant hunger even after eating, extreme fatigue, blurry vision, and slow-healing sores or frequent infections. Particularly in the case of type 2 diabetes and prediabetes, symptoms may not be noticeable for years, which can make the condition difficult to detect. Now, let's delve into the causes. Diabetes develops when your pancreas isn't able to produce enough insulin, or when your body fails to use the insulin effectively. This can lead to a buildup of sugar in your bloodstream, resulting in high blood sugar levels, the hallmark of diabetes. There are several factors that could contribute to the development of diabetes. Genetics play a significant role. If you have a family history of diabetes, you may be at a higher risk. Lifestyle choices also have a significant impact. Lack of physical activity, poor diet, and obesity can all increase your likelihood of developing the condition. Type 1 diabetes, however, is caused by an autoimmune reaction where the immune system attacks the insulin-producing cells in the pancreas. Knowing the symptoms and causes of diabetes can help you detect the condition early and seek timely medical attention. So, be proactive about your health. Awareness and understanding are the first steps towards prevention and management. How do doctors diagnose diabetes? Well, several tests can confirm the suspicion of diabetes. A fasting blood sugar test is one of the most common. In this test, you're required to fast overnight, then a sample of your blood is taken and tested first thing in the morning. If your fasting blood sugar level is 126 milligrams per deciliter or higher on 2 separate tests, you may be diagnosed with diabetes. There's also the random blood sugar test. Regardless of when you've last eaten, a blood sample is taken. If your blood sugar level is 200 milligrams per deciliter or higher, you might have diabetes. Lastly, there's the A1C test, which provides a 2 to 3 month average of your blood sugar levels. If your A1C level is 6.5% or higher on 2 separate tests, you could be diagnosed with diabetes. Early diagnosis of diabetes is crucial for effective management and prevention of complications. How can you manage diabetes and keep your blood sugar levels in check? This is a question many people ask when they or a loved one are diagnosed with diabetes. Let's delve into the various treatment approaches that can help keep diabetes under control. The management and treatment of diabetes primarily revolve around keeping blood glucose levels as near to normal as possible, without causing hypoglycemia or low blood sugar. This is achieved through a combination of medication, insulin therapy, and lifestyle changes such as diet and exercise. Medications are often the first line of treatment, especially for those with type 2 diabetes. There's a wide array of medications available, and the choice depends on many factors, including the type of diabetes, the patient's overall health, and the presence of any other health conditions. Some people may need a single medication, while others may need a combination of drugs to manage their blood sugar levels effectively. Then there's insulin therapy. This is crucial for people with type 1 diabetes because their bodies don't produce insulin, but it can also be used in managing type 2 diabetes when other treatments are no longer effective. Insulin therapy involves injecting insulin into the fat just under the skin. The frequency and dosage depend on the individual's specific needs and the type of insulin used. But treatment isn't just about medication and insulin. Lifestyle modifications play a key role in managing diabetes. A balanced diet rich in whole grains, lean proteins, fruits and vegetables can help control blood sugar levels. Regular exercise such as walking, swimming or cycling can also help lower blood sugar levels and boost insulin sensitivity. Moreover, self-monitoring of blood glucose levels is an essential part of managing diabetes. Regular checks can provide insight into how diet, exercise, and medication are affecting blood sugar levels, allowing for timely adjustments to the treatment plan. Lastly, remember that managing diabetes is a lifelong commitment. Regular checkups and ongoing communication with healthcare providers is crucial to ensuring the treatment plan is working and to make any necessary adjustments. Effective management of diabetes can significantly improve your quality of life and prevent serious complications. So take the reins and manage your diabetes because you are stronger than you think. Can you prevent diabetes? If so, how? The answer is yes. Prevention is possible, and often it's about making the right choices for your body. One of the most effective ways to prevent diabetes is by maintaining a healthy weight. Extra pounds, particularly around the waist, increase your risk of type 2 diabetes. So how can you maintain a healthy weight? Eating a balanced diet is key. Opt for whole grains, lean proteins, fruits and vegetables, while limiting processed foods and sugary drinks. Physical activity is another vital component of prevention. It helps control weight, uses up glucose as energy, and makes cells more responsive to insulin. Strive for at least 30 minutes of moderate intensity activity, like brisk walking, on most days of the week. Lastly, regular health checkups are crucial for early detection and management of prediabetes, a condition that precedes diabetes. Prevention is always better than cure, and with the right lifestyle choices, you can significantly reduce your risk of developing diabetes. What does the future hold if you have diabetes? This question is often at the forefront of one's mind when diagnosed with such a condition. However, the prognosis for diabetes is not as grim as it might initially seem. With proper management, individuals can lead a normal and healthy life. This includes maintaining a balanced diet, regular exercise, and taking prescribed medications. Yet, it is crucial to understand the potential complications if diabetes is left uncontrolled. Persistent high blood sugar levels can lead to serious health issues over time, such as heart disease, kidney damage, nerve damage, and even blindness. This makes consistent monitoring and control of blood sugar levels paramount. Advancements in medical technology, such as insulin pumps and continuous glucose monitors, have made managing diabetes more convenient than ever. And research into new treatments and potential cures is ongoing. Though diabetes is a lifelong condition, it doesn't have to define your life. Proactive management can help you lead a fulfilling life despite the disease. What does living with diabetes look like? Well, it's all about balance. Regular monitoring, maintaining a healthy lifestyle, and seeking support are crucial elements of managing this condition. Living with diabetes means keeping a close eye on your blood glucose levels. Regular testing ensures you're staying within your target range, which can help prevent complications down the line. Maintaining a healthy lifestyle is also key. A balanced diet, regular physical activity, and adequate sleep all play a role in keeping your diabetes under control. It's not about deprivation, but making smart choices that nourish your body without spiking your blood sugar. And let's not forget the importance of support. Whether it's from healthcare professionals, loved ones, or fellow diabetes warriors, having a support system can make a world of difference. But what about the emotional impact of a diabetes diagnosis? It's okay to feel overwhelmed. It's okay to feel scared. What's important is not to let these emotions dictate your journey. Seek professional help if you need to, join a support group, or talk to someone who understands. Remember, it's perfectly fine to have bad days. What matters is that you pick yourself up, dust yourself off, and keep going. And finally, don't forget to celebrate your victories, no matter how small they may seem. Every step you take towards managing your diabetes is a triumph worth celebrating. Living with diabetes may be challenging, but remember, you're not alone. With the right resources and support, you can navigate this journey confidently.